This is Ultra 106.5 and I'm with Jim Kiss from the Red Cross. G'day, Jim.
Morning, Scott. How are you?
I'm doing all right. Now, I've got a thing shoved in my arm here, which is taking blood from my arm. Obviously, there's a bit of a shortage at the moment.
There is a winter shortage. It's the second shortage we've had, in fact, this year, which is a little bit unusual. And what normally happens in situations like this is that, unfortunately, because our donors end up with colds and flus, they are unable to donate at the time. So we are being hit with lack of donors, mainly because of them having colds and flus, not only in Tasmania but nationally.
Now, it's actually not that bad. I mean, I got this put in and they had to jab me a couple of times to find the vein, but it's really not that bad an experience, and obviously it helps save lives, doesn't it?
That's right. I mean, most people who've gone through the process describe it as being pinched on the forearm, and certainly our trained and professional staff are here to help people if they have any apprehensions or difficulties with the needle process. Which, at the end of the day, if the donor just remembers that they're there to save 3 lives and the small amount of pain that they do have to put up with, and time, a small price to pay for the end result.
And I guess to our listeners, you know, if they were the person who maybe was in a car crash and needed a blood transfusion, they would hope that the blood would be there. But really, you have to give the blood for it to be there, don't you?
That's right. And certainly, I mean, one of the biggest risks that we face in terms of blood supply is simply not having enough blood when and where it's required. And at this time of normal donors being unable to donate, we do occasionally run into difficulties. In Tasmania, we use in the order of 600 donations every week to transfuse patients in hospitals, and nationally that's in the order of 21,000.
This blood that I'm giving, is there like a lifespan? I mean, does it go bad after a while?
The blood's actually separated into 3 components. That's where we say it can save up to 3 lives. The main component, which most people would be familiar with, is the red cells. That lasts up to 42 days. The vast majority will be transfused within 2 weeks from you collecting it to being administered into a patient. There is another product that we make used largely for cancer patients and other patients undergoing treatment for leukemia. That's platelets. That has a 5-day lifespan. And then there are plasma which we can last up to 12 months, and that's used to make a whole range of plasma products.
I guess different people have different fears as far as giving blood. I mean, I was just scared about getting a needle put in my arm, but the other fear I've often had too is it safe for me, you know, as a donor? I mean, is everything clean and all that sort of stuff? Obviously, that would have to be the case, wouldn't it? Certainly,
everything is disposable. It's only used once. So from a donor point of view, the safety is absolute priority.
Well, there you go, guys. You've had the lowdown on giving blood. Now it's your job to call the Red Cross and give blood yourself at this time where they urgently need it. Now, what's the best number to call, Jim?
The best number is 13 14 95. And if we can just add one small point, just recently in Tasmania, the youth donor legislation was amended to allow youth between 16 and 18 to donate without parental consent, which just makes that a little bit easier. So with the school holidays coming up, perhaps there are some kids out there aged 16 who would like to donate. Feel free to call 13 14 95 to make an appointment.
And I understand you get a free milkshake afterwards and even some jelly beans.
You do, and we have some other beverages there too, which they can certainly help themselves to.
Thanks, Jim. That's Jim Kiss from the Red Cross. That number again is 13 14 95. This is Ultra 106.5.